Hello everyone, this is Dr. Shishma Sarila, consulting homeopath at Fidicus Homeopathy. Now coming to the conventional form of treatment or allopathic form of treatment, what would a gynecologist do or suggest you to do or take if you're suffering from PCOS, which is combined with endometrial hyperplasia? So they would first suggest you with progestins, which is a synthetic form of progesterone, so that your hormone balance is maintained. But as soon as you stop using it, you will have a recurrence of the symptoms, right? They will be advising you to use oral contraceptives. If not taken properly, it can cause mid-menstrual bleeding. It has side effects like bloating. It has GI effects. Some people do experience weight gain, hair fall, skin becoming a little bit oilier, and acne prone skin are some of the side effects of oral contraceptives. And if you're someone who is planning to get pregnant, then oral contraceptives might not be your choice of medication. And then we have metformin, which is given for diabetes condition. If you're someone who's suffering with superadded diabetes condition along with the PCOS and endometrial hyperplasia, metformin is given. But metformin on a longer run will cause muscle deterioration, as we can cause there is deterioration in the size of the muscle. Apart from that, there are surgical processes. If the condition is not getting control with the medications, they would suggest you two types of surgeries, the one being hysteroscopy with endometrial ablation and hysterectomy. You know hysterectomy, right? That is complete removal of the uterus. If you're removing the uterus before menopause, what happens? You will be experiencing decrease in your serum calcium levels, decrease in your estrogen levels, decrease in your progesterone levels. That will have an impact on your bone health, that will have an impact on your skin, impact on your hair, impact on overall immunity as well. You will be experiencing hot flushes, you will be experiencing severe mood changes, right? And then apart from that, you're someone who is thinking of getting a hysteroscopy with endometrial ablation, then this is for you. See, this is called an hysteroscope. It's an instrument wherein first a speculum is inserted into the vaginal orifice to enlarge the vaginal orifice, and then the hysteroscope is inserted, which has light or bulb in the rear end of it. So what happens is that with the hysteroscope, they will be locating what the problem is, and they will do endometrial ablation, which is called as removal of the endometrial tissue, excess endometrial tissue. But if you're someone whose hormones are not under control, you're having severe hormonal imbalance, then although you get this endometrial ablation done, you will experience, or you can experience, a recurrence of symptoms after 2 or 3 months of endometrial ablation, because I've seen cases in our clinic who have had recurrency in the endometrial hyperplasia even after getting endometrial ablation, and they've been told to get hysterectomy done, but they have not yet planned for another kid, so they have come to help for us. So situation can get complicated if you are not treating your PCOS in the starting stage, right? That is something that you have to understand, that do not super complicate your diseases, because it would be hard to treat in any system of medicine. Now coming to homeopathic form of treatment, you have understood how conventional form of treatment, if you stop using conventional form of treatment, then you will have recurrence of symptoms. They have side effects even while using, and apart from that, sometimes even after using also, if you do not get any proper expected way of prognosis, they will be advising you for surgery. Apart from all this hassle basil, you have a kind of medicine which is safe, which is effective, which can increase your fertility, which can understand the link between your mental thought process, your physical symptomatology, which can differentiate you from all your family members, which can individualize you, give medication which is specifically made for you, which will decrease your menstrual cramps, which will increase that menstrual cycle to 28 days, or keep it in a healthy balance between 28 days to 30 days, and then decrease the clot size, regularize your menses, and then give you a better result without any side effects. That is nothing but homeopathic form of treatment, and it helps in curing the symptoms, it helps in relieving your symptoms, and it helps in preventing furthermore recurrences of these symptoms. Now we get to the consultation part. We have understood how homeopathy is a better choice in lifestyle disorders. Now I'll be explaining to you how Fidicus Homeopathy is much better choice. Here at Fidicus Homeopathy, in consultation options, we have two kinds of options, one being online, the other being in person or the offline consultation. If you are someone who is staying nearby the nearest branch of Fidicus, you can come and contact us in person and take doctor consultation. If you are someone who is staying far away from us, you can contact us online either through audio consultation option or through the video consultation option. After taking doctor consultation and after carefully inspecting your investigation reports, especially to the online clients, medicines will be home delivered to you. If you're staying in India, it can take 3 to 4 business days. If you're staying in USA, 3 to 5 business days. Apart from that, anywhere in the globe, it can take 4 to 8 business days for our medicines to reach your doorstep. If you would like to get in touch with us, you can call us, WhatsApp us, or messages on us on this number. Apart from that, if you would like to know more about Fidicus Homeopathy, you can check our website www.fidicus.com. If you're someone who's suffering from female reproductive organ diseases, then Fidicus Homeopathy is the answer. Why should you be choosing Fidicus Homeopathy? Because Fidicus Homeopathy stands for highest chance of health, and here we follow 3 basic major principles. What are they? First one, we are experiencing high success rate in treating cases like endometriosis, adenomyosis, dysmenorrhea, cervical erosion, bulky uterus, endometrial hyperplasia, PCOD, PCOS, and even cases which contain ovarian cysts. So we're having high success rate in this. Apart from that, the treatment here is transparent. That is, there is no gray area between the patient and the doctor. We will be giving you a perfect picture of your prognosis as well. And then the personal care here at Fidicus Homeopathy is top notch, because here we will be educating you on all the symptoms that you develop. Any of your queries or questions will be answered. So if you want to choose health, if you want to choose cure, choose Fidicus Homeopathy.